Okay, so now we're working on strengthening core muscles again. Now, let's say that we've rolled out, we've released some of that tension in the glutes. That's going to help with that low back pain, that hip pain at night. But what we want to do is give our body new tools to hang on with. So we've talked about lifting the pelvic floor, feeling that lower transverse abdominis fire. But now we want to talk about my most favorite muscle in the whole world, the glute medius. Now I know I feel like a bit of a traitor. As a pelvic floor physio, I'm supposed to be all about the pelvic floor. But man, I really think this glute medius muscle, this is a muscle that's on our hips, is maybe the most important muscle that we have when we're pregnant. So this muscle is in charge of holding us together from the outside. It helps hold our hips together. It helps hold our pelvis together. And this guy is amazing. Now again, when you're pregnant, you get really good at being arched through your back. Sometimes your feet can turn out a little bit and we kind of hang out here for a lot. Again, that can put a lot of compression and loading on our low back that can hurt our hips. So what we want to do with all our core training is use the pelvic floor, use our lower muscles, and use this transverse abdominis and this glute medius muscle to help hold us together from the outside, help hold up some of that weight of the baby. So to strengthen the glute medius, it's great if you can kind of roll out first. So if you can kind of get rid of some of that tension in there, that's wonderful. Then what you want to do is you want to grab a TheraBand and you want to step on your band. Doesn't matter if it's kind of wrinkled or anything. And you want to go kind of about the same width apart that your pelvis is. So you don't want to be terribly wide. You want to be nice and narrow here. And you'll crisscross the band in your hands, get a little bit of tension on there, and you're going to hinge at your hips a little bit. So you're going to stick out your bum a little bit, and you're going to be standing with nice straight feet, and you've got your band. Now what you're going to be doing is you're going to take a step to the side and slowly bring this other foot over. Now careful, that band's going to want to slingshot you over. So you're going to take a step to the side, slowly bring the other foot over, take a step to the side, slowly bring it over. Watch that your knees aren't over your feet. Sometimes that can hurt the knees a little bit. So again, imagine that you're taking a bow, you're sticking out your bum a little bit, but you're still nice and upright. Now, if you want to be extra clever, use a little bit of your pelvic floor, lift these muscles up, feel your abs flatten down there, that lower abdominal muscle. And you want to do about 8 to 10 steps in one direction. Again, nice and slow. Watch that you're not lurching, using those oblique muscles to do the movement. That's a little bit of a cheat. Keep it nice from your hips so your upper body stays nice and still, nice, slow, and controlled. Again, watch that your foot doesn't turn out to the side. That would arguably maybe make the situation worse. If you're turning your foot out to the side, you're tightening up through all those glute muscles again, might be contributing to having a little bit of that low back pain. So what we want to do is keep the foot totally straight, nice and slow and controlled movements. Again, not trying to lurch. And you'll feel this muscle, you'll feel a nice burn happening here. So you take about 8 to 10 steps, take a little break, shake it out, take a couple steps in the other direction. Again, you can be really smart and clever, think about your pelvic floor a little bit. But it's a hard exercise. We call this the monster walk. But man, it's a great one for keeping our hip muscles nice and strong through the pregnancy. It's probably one of my favorites.